Welcome to the Evolution of Vaccination. My name is Angel Ramon Leal Gatza Siet, and I will be your guide. Let's begin with the invention of the hypodermic needle. Despite its impact on the science of pharmacology, morphine had limited medical impact until the invention of the hypodermic needle in the 1850s. A number of individuals are associated with the invention of the hypodermic needle. Among them, Alexander Wood, a Scottish physician, is perhaps the most prominent. Wood used morphine in conjunction with his newly invented needle to treat a patient with neuralgia, otherwise known as a sharp pain in the nerves. Unfortunately, Wood also used his device on both he and his wife, and both became addicted. In addition to inventing pasteurization to kill bacteria and keep food such as milk fresh, Louis Pasteur is famous for having studied the causes of sickness in humans and animals. Pasteur widely popularized the idea that many diseases were caused by bacteria, the most ancient type of cellular life on Earth. Bacteria are found literally everywhere, except where humans have purposefully used chemicals or sterilization to prevent their growth. The poor health conditions of war thus often make it easier for transmission of bacteria and viruses between humans. The Civil War was a breeding ground for diseases caused by bacteria and viruses. Pasteur is shown giving a boy one of the first live vaccines against rabies after he discovered the germ theory. The germ theory is a fundamental tenet of medicine that states that microorganisms, which are too small to be seen without the aid of a microscope, can invade the body and cause certain diseases. The germ theory was formed by discovering that weak forms of disease could be used as an immunization against stronger forms, and that rabies was transmitted by viruses too small to be seen under the microscopes of the time. Jamie Farron's 1885 cholera vaccine was the first to be used against a human bacterial disease. However, cholera vaccines have never been enormously effective and only confer immunity for a short period. Cholera is an acute diarrheal illness caused by infection of the intestines with bacterium Vibrio cholerae. The infection is often mild or without symptoms, but can sometimes be severe. Approximately 1 in 10 infected persons will have severe disease, characterized by profuse watery diarrhea, vomiting, and leg cramps. In these people, rapid loss of body fluids leads to dehydration and shock. Without treatment, death can occur within hours. Emil von Behring was one of the founders of the science of immunology. His discovery of the diphtheria and tetanus antitoxins paved the way for the prevention of these diseases through the use of immunization. It also opened the door for the specific treatment of such diseases with the injection of immune serum. Behring's stature as a seminal figure in modern medicine was recognized in 1901 when he received the first Nobel Prize in Physiology or Medicine. It was while working in Robert Koch's laboratory that Behring began his pioneering investigations of diphtheria and tetanus. Both of these diseases are caused by bacilli, a class of bacteria that do not spread quickly through the body, but produce generalized symptoms by excreting toxins. Diphtheria, nicknamed the strangling angel because of the way it obstructs breathing, was a terrible killer of children in the late 19th century. Its toxin had first been detected by others in 1888. Tetanus, likewise, was fatal more often than not. In 1889, the tetanus bacillus was cultivated in its pure state for the first time by Shibasudo Kitasoto, another gifted member of Koch's team. The next year, Behring and Kitasoto jointly published their classic paper, The Mechanism of Immunity in Animals to Diphtheria and Tetanus. 1 week later, Behring alone published another paper dealing with immunity against diphtheria and outlining 5 ways in which it could be achieved. These reports announced that injections of toxin from diphtheria or tetanus bacilli led animals to produce in their blood substances capable of neutralizing the disease poison. Congress passed the Biologics Control Act on July 1st, 1902. The act established the Center for Biologics Evaluation and Research, and tasked a specifically created board of health officials from the military and public health agencies to set forth rules controlling the sale and preparation of biologics, including viruses, serums, toxins, antitoxins, and analogous products in international or foreign commerce. The Act also specified that biologics must be produced in licensed facilities, be recorded and tested before distribution, and be marked with expiration dates. From 1903 to 1906, the federal government added more regulations governing standards for lab cleanliness, inspections, record-keeping, quality control, and safety testing. The Pure Foods and Drug Act, passed in 1906 after public outcry over adulterated meat products, required that some medicines list their ingredients and forbade the sale of many dangerous patent medicines, such as commercial remedies often of little or no therapeutic value. In 1912, the Public Health Service was granted expanded research authority. In addition to the research spurred by the Biologics Control Act in the emergent field of immunology, federal researchers began to study non-contagious diseases. In 1913, the Virus Serum Toxin Act aided ranchers and farmers by addressing the safety, purity, and quality of animal biologics. The 1938 Federal Food, Drug, and Cosmetic Act shifted U.S. regulation of most medicines and cosmetics to the newly created Food and Drug Administration. However, the FDA was not responsible for regulating vaccines until 1972. The Public Health Service, and later the National Institutes of Health, regulated vaccines until then. World War I claimed an estimated 16 million lives. The influenza epidemic that swept the world in 1918 killed an estimated 50 million people. 1/5 of the world's population was attacked by this deadly virus. Within months, it had killed more people than any other illness in recorded history. The plague emerged in 2 phases. In late spring of 1918, the first phase, known as the 3-day fever, appeared without warning. Few deaths were reported. Victims recovered after a few days. When disease surfaced again that fall, it was far more severe. Scientists, doctors, and health officials could not identify this disease, which was striking so fast and so viciously, eluding treatment and defying control. Some victims died within hours of their first symptoms. Others succumbed after a few days, their lungs filled with fluid, and they suffocated to death. An iron lung is a mechanical respiratory device used to force air into and out of the lungs of people unable to breathe for themselves. Invented in 1929 by Philip Drinker, a professor at the School of Public Health at Harvard University, the iron lung was one of the earliest devices designed for this purpose. During the 1920s, people with respiratory failure were aided by a pulmotor, a contraption similar to fireplace bellows, which inflated and deflated the lungs by forcing air in and sucking it out. The process worked, but patients experienced chest pain because the amount of air forced into the lungs was not adjustable to the individual patient's lung capacity. Many people suffered from poliomyelitis, which often paralyzes muscles of the diaphragm, the large dome-shaped muscle above the stomach, which rises and falls to draw air into and push it out of the lungs, required the aid of these devices to stay alive. Cell cultures involve growing cells in a culture dish, often with a supportive growth medium like collagen. A primary cell culture consists of cells taken directly from living tissue and may contain multiple types of cells. Cell strains are designed to be a culture that contains only one type of cell. This is done by taking subcultures from the original culture until only one type remains. Primary cultures can be manipulated in many different ways in order to isolate a single type of cells. Spinning the culture in a centrifuge can separate large cells from smaller ones, for example. Eventually, when only a single type of cell remains, researchers can try to establish a cell line. Cell lines allow for continuous observation and control that may not be possible in larger tissue cultures containing multiple types of cells. Using cell strains and cell lines, researchers can grow human pathogens like viruses in a particular type of cell to weaken them. One way viruses are adapted for use in vaccines is to alter them, so that they are no longer able to grow well in the human body. This may be done by repeatedly growing the virus in human cells kept in culture at a much lower temperature than normal body temperature. In order to keep replicating, the virus adapts to become better at growing at the lower temperature, thus losing its original ability to grow well at normal body temperatures. Later, when it's used in a vaccine and injected into a living human body at normal temperature, it still provokes an immune response, but can't replicate enough to cause illness. Penicillin was first tested for military use in the spring of 1943, with pilot studies on soldiers with chronic bacterial infections. By autumn, doctors were using antibiotics in combat zones, where it was limited to American and Allied military and to patients with life-threatening infections. The first U.S. wounded to directly benefit from the drug were the flight crews of the 8th Air Force, stationed in Britain. Rationing was necessary, as a single infection could require 2 million or more units of the drug. Single ampules, sealed glass vessels, holding solutions for hypodermic injection, contained 100,000 units. During the war, the armed forces received 85% of the nation's production, which amounted to 231 billion units in 1943. With the implementation of successful mass production techniques, 1,633 billion units were produced in 1944. and 7,952 billion units in 1945. Penicillin became the war's wonder drug, and its remarkable medical effects on infectious disease made World War II different from any previous war. Penicillin is now used all over the world, thanks to the work of scientists and their staff, together with the Illinois farms and numerous drug companies. The drug saved the lives of hundreds of thousands of war victims during World War II and has continued to shorten illness and save lives every day since. The vaccine was given to volunteers who had not had polio, including Salk, his laboratory staff, his wife, and their children. The volunteers developed anti-polio antibodies, and none had bad reactions to the vaccine. Finally, in 1954, national testing began on 1 million children, ages 6 to 9, who became known as the polio pioneers. Half received the vaccine and half received a placebo. 1/3 of the children who lived in areas where vaccine was not available were observed to evaluate the background level of polio in this age group. On April 12, 1955, the results were announced. The vaccine was safe and effective. In the 2 years before a vaccine was widely available, the average number of polio cases in the U.S. was more than 45,000. By 1962, that number had dropped to 910. Salk never patented the vaccine, nor did he earn any money from its discovery, preferring to see it distributed as widely as possible. In 1961, Dr. Benjamin Rubin, a researcher with Wyeth Laboratories in Pennsylvania, and Gus Chakros, an engineer with the Reading Textile Machine Company, developed a bifurcated needle that could deliver smallpox vaccine into the skin cheaply and easily, with a minimum of training. The design of the needle was simple yet elegant. It consisted of a short length of steel wire hammered flat at one end and then punched to form 2 sharpened tines. When the needle was dipped into a vial of freeze-dried vaccine that had been rehydrated with solution of 50% glycerin, a single drop of the viscous liquid was held by a capillary action between 2 tines of the needle. The bifurcated needle was so easy to use that it was hard to make a mistake. Unskilled villagers could learn the technique by practicing for 10 minutes with an orange or a grapefruit. At collecting points where large groups of people gathered, a single health worker could vaccinate about 500 persons a day. Going from house to house, it was possible to perform about 120 vaccinations a day. The World Health Organization was established in multiple nations. The matter took place in Paris, and the goal was to establish rules and regulations in case of outbreaks in one nation or the other. The objective of this organization was to have the highest possible health for all the people in these nations and essentially the world. Although there is always some tension between countries, the articles for its constitution agreed that they would put their tension aside when it came to the health of their citizens. More articles were assigned to the fact that the knowledge of health and medicine needed to be increased in all countries. Due to this article, the countries started taking precautions that would aid in the prevention of the spread of diseases. The significance of this constitution is a topic that people pay no mind to. Healthcare. They first targeted malaria and STDs, then moved on to the more complicated diseases that still have no cure, such as Alzheimer's and other mental illnesses. Together, these countries would fight what epidemic that might come their way. Smallpox, also called variola, was an acute contagious viral disease, with fever and pustules usually leaving permanent scars. The World Health Organization came together to help decrease the diseases that spread through different countries. The anti-smallpox worked, and people started getting cured of this horrible disease. The World Health Organization was responsible for joining together, and the result is priceless. Despite the fact that some countries believe that Russia had invented smallpox to use as a biological warfare weapon, the 18 countries in the organization assimilated smallpox and even helped the accused Russian citizens to eradicate the disease. The Russians turned out to be guilty for the development of the weapons and smallpox, but all of it was destroyed in the 1980s. There are still conspiracy theories that believe they still have acquired those weapons again, but as of yet, smallpox remains eradicated. With the World Health Organization, if another pandemic breaks out, they will forge together to battle whatever it is that is causing destruction. There's still hope for peace due to the fact that they can come forth and help each other in times of need. The new development of vaccines has caused the prevention of what were once incurable diseases such as polio and smallpox. Europeans were one of the first to make their own kind of vaccinations against the smallpox epidemic. It may not have been as effective as it is now, but it did slow the spread. The scientists that helped produce the vaccines ran into roadblocks. One significant problem that they came across was that some diseases were regenerating. This led to the Global Program for Vaccines and Immunization, joining the expanded program on immunization and the program for vaccine development. where multiple scientists work together to aid in the improvement of the vaccines themselves. There are lots of roles that are played in the improvements of vaccines. Everything depends on two things: the disease and the patient. If the patient responds differently with a certain medication, and then certain vaccines could be harmful. Yet, scientists have even found ways to overcome those barriers. By studying the diseases with care, the vaccination program has globally affected the world in a positive way. The Project BioShield Act was an act passed by the United States Congress in 2004, calling for $5 billion to purchase vaccines that would be used in the event of a bioterrorist attack. George Bush was the president at the time and signed the law on July 21, 2004. With such a big amount of money set aside just for this, it assures the government that in case there is an attack that the government should not panic because they have the resources to bounce back. BioShield was being developed privately for obvious reasons, so that other countries would not be able to get their hands on United States defenses. It was so private that only small companies were involved in out-of-place locations to develop this. Since it was in smaller companies, the rate at which the defenses were produced was greater than what it would have been if it were very advertised. Although this project was just an act that was passed, it is the first step to a recovery in case something happens. To have a plan is better than blindsided any day of the week. As we've learned, vaccines are the safest tool to stop diseases. The appointment of Jenny McCarthy as the newest host of the American talk show The View has sparked a recent string of outrage among public health officials. McCarthy is a well-known anti-vaccine activist who attributed her son's condition, Landau-Kleffner syndrome, often confused with autism, to vaccinations. Doctors fear McCarthy's new position will gain the anti-vaccination movement more credibility, even though there is no science to support it. On McCarthy's new position around the table, health officials are concerned about the potential spread of misinformation. Every type of tool we have in medicine has some type of adverse effect. Vaccines are among the safest tools we have in modern medicine. The vast majority of reactions to vaccines are mild and temporary, like a sore arm or a slight fever. Severe reactions are very, very rare.